Hi, hello everyone. Today we will discuss hematology. A 32 years female admitted with weakness, lassitude, dyspnea for last 1 year. No organomegaly. What is your diagnosis? Nutritional anemia or iron deficiency anemia. Name the diseases in which microcytic hypochromic blood picture is seen. Iron deficiency anemia, thalassemia trait, thalassemia intermedia, thalassemia major, HBH disease, HBE thalassemia, and some cases of anemia of chronic disorders show the microcytic hypochromic blood picture. Biochemical markers of iron deficiency anemia. Serum iron, serum ferritin, serum transferrin receptors, total iron binding capacity TIBC, transferrin saturation are the biochemical markers of iron deficiency anemia. Out of this, serum ferritin, the single test will detect the iron deficiency anemia. Parameters on the cell counter report which differentiate IDA from thalassemia. RDW. RDW, red cell distribution width, is more than 15% in iron deficiency anemia and less than 15% in thalassemia trait. How would you evaluate response to therapy in iron deficiency anemia? By reticulocyte count on the day 7 of the iron therapy, you can evaluate the response to therapy in iron deficiency anemia. What is the bone marrow picture in iron deficiency anemia? The bone marrow picture in iron deficiency anemia will be micronormoblastic erythropoiesis. The late normoblasts have persistent basophilia with fraying of the cell borders. Lady, 28 years old, admitted with history of weakness and dyspnea on exertion. She is pale and the liver is palpable. What is your diagnosis? Megaloblastic anemia. It may be because of the folic acid deficiency or it may be because of the B12 deficiency. What is the defect in folic acid or B12 deficiency? The rate of DNA synthesis is retarded and therefore the nuclear maturation lags behind the cytoplasmic maturation. What are the morphological changes in folic acid or B12 deficiency? There is macrocytosis with hypersegmented neutrophils and megaloblastic erythropoiesis. What are the CNS manifestations in folic acid or B12 deficiency? Subacute combined demyelination of the posterolateral columns results in CNS manifestations. Why nucleated red cells seen in a megaloblastic anemia? The nucleated red blood cells are released from the extramedullary hematopoiesis or hemopoiesis in liver and spleen. As a result, the nucleated red cells are observed in a megaloblastic anemia. What is the blood and bone marrow picture in multiple deficiency anemias? In the peripheral blood, it demonstrates dimorphic blood picture of microcytic hypochromic and macroolocytic red blood cells, and in the bone marrow it reveals dimorphic, that is micronormoblastic and megaloblastic erythropoiesis or macronormoblastic marrow. What is the effect of folic acid or B12 therapy on the bone marrow? In 24 hours, erythropoiesis will revert from megaloblastic to normoblastic picture. Picture in vitamin C deficiency anemia. Macrocytic anemia with normoblastic erythropoiesis will be seen in vitamin C deficiency anemia. For blood grouping, which is better and why? Tube method or slide method? The tube technique is better because the reaction between the cells and the serum is enhanced because of the centrifugation, and therefore weaker antigens like A2 are also detected in the tube method. What is the purpose of cross-matching test or compatibility test? This test prevents the transfusion reactions. What is Bombay blood group? Bombay phenotype are individuals who lack H antigen, represented by small h genotype. H substance is not formed and no antigen A or antigen B develops even though an individual may possess A and B genes. What are the causes of hemolytic disease of the newborn? Hemolytic disease of the newborn is due to ABO disease and RH disease. What is the most useful cytochemical stain in differentiating ALL and AML? Myeloperoxidase stain is positive in most of the subtypes of AML and it helps in differentiating it from ALL. What is thalassemia intermedia? Thalassemia intermedia denotes a group of double heterozygous patients whose clinical features are intermediate between those of the thalassemia trait and thalassemia major. It includes double heterozygous beta positive, beta 0 and also of HBS thal, HBE thal, HBD thal and alpha thal, beta thal. HbF varies from 20 to 40% in majority of the cases. Which are the abnormal hemoglobins of alpha gene abnormalities that are seen in India? HBH disease, HBJ Meerut and HBQ India. What are the causes of basophilia? Basophilia is observed in chronic myeloid leukemia, myelofibrosis, basophilic leukemia and mastocytosis. What is buffy coat and what are its uses? When a Winthrop tube is centrifuged for packed cell volume, white cells collect on the top of the red cells and a pale band of about 1 mm is seen. Its width increases in cases with very high total leukocyte count, that is in leukemias. Its main uses are the buffy coat is used in LE cell preparation. Buffy coat is also useful in subleukemic leukemias where morphology or cytochemistry of blast is studied on buffy coat. What is an LE cell? LE cell is a neutrophil with phagocytosed denatured nuclear mass of neutrophils. What is a thick smear and what is its use? Thick smear is made by spreading a drop of blood on the slide in an area of about 2 cm. This smear is given 2 to 4 dips in the tap water till the red colored solution comes out, that is dehemoglobinization of the smear. Then the smear is fixed in the methanol and stained with Leishman stain or Giemsa stain. It is of use in quick detection of the malarial parasites.